Hello, everyone. It's Coach Cary here, and um, today we're talking about sciatica and how we could help people with sciatica. And I'm Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, British Columbia. Yesterday we talked about back pain and how we could help people with back pain, and today we want to talk about sciatica. Sciatica is related to back pain because the sciatic nerve comes out of the lower part of the spine. We're going to talk about that today. So thank you for joining me. And this is part of our series of 100 days of self-improvement. And what I mean by self-improvement is um, how can how can you do better with your health in 100 days? So on day 100, how could you be healthier than you are today, which is day 13? So today we're on day 13 of this 100-day journey, and we want to talk more about sciatica today. Sciatica is a condition where the nerve is being pinched or affected in the lower part of the spine, coming out of the lumbar and into the sacral area. And when that nerve is affected, it can cause symptoms in the low back as well as going down your leg. So we're going to talk about sciatica, what causes it, and what you can do to help yourself. Join me for coffee this Saturday. We're going to have coffee with Dr. Cary. We did that the last couple Saturdays and I really enjoyed it. It'll probably be around mid-morning when we do the coffee. And if you have any questions, please type them in the comments or the chat. I'd be happy to answer those questions either today or on Saturday for the coffee with Dr. Cary. So during this 100-day journey, we want to reduce pain, improve mobility, improve posture, and enhance health. That's what we're working on. And at the coffee with Dr. Cary, we'll talk about the past week, the upcoming week, the masterclass we're going to do. We'll do masterclass Mondays, the clinic hours that we have, and the fact that we're taking new patients right now. So today we're talking about sciatica, what causes it and what you can do about it. So sciatica comes from the lower part of your spine, from the last two vertebrae, L4 and L5, and from the first three sacral segments, S1, 2, and 3. Those five nerve roots make up the sciatic nerve, and the sciatic nerve comes out of the left and right part of the spine and travels all the way down your leg to your toes. So how does a chiropractor approach sciatica? Well, we first do a history. We want to understand the background of your condition, and secondly, we'll do an assessment to find out what's causing the sciatica. So we really want to identify, is there one nerve root being affected, or is there more than one nerve root? So we really want to understand your sciatica, and then what can you do to help yourself? So we want to give you some advice and education as far as how you can help yourself. So sciatica does connect to the low back, because in the low back area, there's five vertebrae that come out of the lumbar spine. And L1 is the top vertebrae, and then L5 is the bottom one. If you're on YouTube, you can see my graphic here. If you're on Instagram, just kind of follow along with us here. So five vertebrae in the lumbar, L1 to L5. And for sciatica, it's related to the last two vertebrae, L4 and L5. And you see these nerve roots right here. This is where, if the spine's out of alignment, or if that nerve is being compressed because the foramen is reduced, it can cause pain and pinching of that nerve root. And sometimes the disc gets squished and it can push on that nerve as well. So, so that can cause sciatica. What we want to do is look at the alignment and the function of the person's body and spine. And we want to look at the posture and the tone of the musculature. So what type of tone do the muscles have in that area? The ligaments in the area, the discs. So we really want to assess how everything's functioning in that area. And then we can have a game plan to reduce the pain, improve the mobility, and correct the underlying cause. How do we do that? We do that by adjusting the spine to realign the spine, giving the patient advice on what to do or not to do, giving them some stretches as they progress through care, some postural correction and changes to help them to stay in better alignment, some core strengthening to build up the strength around the spine and create some stability for the spine, some nutritional changes for the joints and their body in general, and some lifestyle changes to help them enhance their health going forward. If you have any questions on sciatica, please type them in the chat. I'm just kind of checking the chat as we go along here. And also on Instagram, you can type in the comments. I'd be happy to answer that. I hope you enjoyed today's presentation on sciatica. If you want to book an appointment in the clinic in Kelowna, we're at the Landmark 4 building. I have the graphic up here on the screen. I'm just going to turn my picture off actually. And so we are at the Landmark 4, which is the building right in the middle between these three glass buildings, parking right in front. And then you can just book an appointment by clicking on the link in the show notes or the link in our bio, and then go to initial chiropractic appointment. Pretty easy to do. We can usually get new patients in within 48 hours. So please go ahead and book an appointment for the next day or the day after. And we'd be happy to help you with sciatica or any other condition that you're currently struggling with. And we'll definitely talk to you guys in the next few days. Tomorrow, we're going to talk about nutrition for the joints. So please join us. We'll be talking about collagen, things like that. And have a wonderful day. And I'll talk to you guys soon.